for joining us for symptom management for anxiety and depression during and after cancer with Dr. Zev Wiener. May is Mental Health Awareness Month, but we know that anxiety and depression can be 365 days a year. And we know this can be a difficult subject to talk about, so we're glad you're here to learn with us today. I'm Jenna Fields. I'm the California Regional Director of Sharsheret. And for those of you who don't know about Sharsheret, we are a national nonprofit organization. We help women and families facing breast and ovarian cancer, as well as those with elevated genetic risk, with our free, confidential, and personalized support and resources. We also provide community health education programming throughout the country, including our webinar series, which during COVID we've been doing about once a week. So please stay tuned for all of our programming. We do have a few great webinars coming up. On May 10th, a little bit of a lighter subject, we're doing a program. It's a Shavuot Family Bake Fest. So my colleague is going to put the link for that in the chat if you'd like to register. We're also doing a Shalom Shabbat music and insights inspiration for the week ahead on Friday, May 14th at 12:30 Eastern. And then on May 20th, we're doing a Zentangle therapeutic doodling workshop. And that'll be a great program as well. So all three of those programs, the link is in the chat. Before we begin, a few housekeeping items. Today's webinar is being recorded and will be posted on Sharsheret's website along with the transcript. However, your faces and names will not be in the recording. If you would like to remain private during this presentation, you could turn off your video and rename yourself. You can also call into the webinar. There won't be a PowerPoint, so if you're more comfortable calling in, please do so. Instructions for that are available in the chat box right now for you. We are also now offering closed captioning for our free webinars. So simply click on the closed captioning button on the bottom of your toolbar and click Show Subtitle to enable closed captions on the bottom of your screen. We're going to have a Q&A at the end. I'm going to ask you to keep yourself on mute the entire time, please. I'll be moderating the Q&A. We did receive your questions in advance, so we'll be getting to those as well. If you would like to submit a question privately, please feel free to message me directly, my colleague who's marked as Sharsheret, and Bonnie Betkoff, who's our Senior Support Program Coordinator. All three of us will be taking those questions and getting to as many as we can with Dr. Wiener. Thank you so much to our sponsors, Merck, CGen, and the Centers for Disease Control and Prevention for supporting today's webinar and making our webinars possible. A medical disclaimer, Sharsheret is a national not-for-profit cancer support and education organization and does not provide any medical advice or perform any medical procedures. The information provided by Sharsheret is not a substitute for medical advice or treatment for specific medical conditions. You should not use this information to diagnose or treat a health problem. Always, please seek the advice of your physician or qualified health provider with any questions you may have regarding a medical condition. So we know mental health and the symptoms that go along with one's mental health can often have a stigma. It's so important that we feel comfortable sharing our thoughts and feelings in a safe environment and a place where we can vent without judgment. Sharsheret is here for you at every stage of your journey, providing tailored support that best fits your needs. And for caregivers as well. I know that we have caregivers on this call today. You can get through Sharsheret individual support with a member of our clinical team of trained mental health professionals and our genetic counselor. We also have a peer support network which connects women newly diagnosed or high risk of developing breast or ovarian cancer with one-on-one with other women who share similar diagnoses and experiences. And then our genetic counselor is available for genetic conversations for those of you who have a family history of cancer. To speak with a member of our clinical team, you can email us or call, and my colleague put that in the chat as well. And again, we recognize that today's topic is a huge issue, and we're only going to be able to scratch the surface of it today. There may come a time when you are feeling extremely overwhelmed and it's affecting your day-to-day routine, and maybe that's how you feel right now. Please don't hesitate to reach out to your healthcare provider about what you're feeling. Speaking one-on-one to a therapist or a psychiatrist can help you gain insight and cope with the feelings you're experiencing. And now it's my pleasure to introduce Dr. Zev Wiener. He received his MD degree from Harvard Medical School and rabbinic ordination from Yeshiva University. He completed his residency in psychiatry at UCLA, where he served as chief resident of the Resnick Neuropsychiatric Hospital. And in addition, he runs a private practice in general psychiatry, where he serves as the attending psychiatrist at UCLA's Sims-Mann Center for Integrative Oncology, where he provides direct patient care and trains physicians in the field of oncological mental health. It is now my pleasure to welcome Dr. Zev Wiener.
Thank you very much, Jenna. Can everyone hear me okay? Okay, great. Yeah, I just wanted to begin by thanking Sharsheret for having me today. Sharsheret's an incredible organization, and it's really been a privilege to get to see the wonderful things that you do each day, and it's a real honor for me to be able to participate in some small form in such an incredible organization. So thank you for having me. You know, when I was asked a number of years ago to accept the position at UCLA in their integrative oncology program, the Sims-Mann Center, I remember debating whether to go for it or not. And I remember somebody telling me, are you sure you want to go into a field like this of, they call psycho-oncology, the interface between oncological health and mental health. And they pointed out, I think, very astutely to me that, you know, as doctors, we care about our patients, and the suffering that we see other people going through affects us on a personal level. It's obviously nothing like the actual pain that someone who's going through the actual illness experiences, but it's not easy. And they said, you know, being a psychiatrist itself is very, very hard. You know, you see a lot of suffering. Mental illness is among the biggest darknesses that a person can experience in this world. And they said oncology is not easy. Being an oncologist, you see a tremendous amount of darkness. And going into a field of psycho-oncology, you're really seeing the hardest of both, right? In terms of the suffering of mental health and the suffering of oncology. And you know, is that something you're sure you want to get into? And I think it was a valid question, and you know, worthy of thinking of, and you know, a real issue that anyone who goes into this field has to consider. And on one hand, there's no denying the fact for sure that it's extremely challenging. You know, it's a very challenging field. You know, sometimes it's hard to appreciate just the enormity of the darkness that people experience when they're going through the journey of oncological treatments. And, you know, I don't think we can ever consider any person in this field a quote unquote expert in psycho-oncology, just because it's such a formidable foe that we're up against. I think you have to have a tremendous amount of humility in this field and recognizing that, you know, we're up against something very, very difficult. But on the other hand, what I've found on a personal level is that there's also something incredibly inspiring in this field. And that even with all the darkness and with the limited abilities that we have as human beings to confront such a gargantuan opponent, the underlying premise of everything that I do is one basic phrase, and that's, there's always something you can do. You know, there's always something that we can do in life. And even in a situation that seems extremely dark, and it is extremely dark, we can add a little bit of light at, you know, at the minimum, and sometimes a lot of light, and to help people. So what I'd like this afternoon is just a few examples of some of the things that we can do, you know, when someone is facing this really harrowing prospect of a cancer diagnosis, of going through treatment, of finishing treatment if they're blessed to do so, or continuing ongoing treatment if you know, if that's what's required, and how there's always something that we can do even in the most trying of times. And I hope to be able to share a little bit of that with you. And I'd be interested to hear from you as well, if there are things that you found that have helped you in this journey. So before we begin, I have to just give a little bit of a disclaimer, which Jenna alluded to as well, but it's very, very difficult to give a talk on the topic of, you know, mental health in cancer, because there's so much variability. You know, first of all, cancers are so different, right? And as we all know, there's certain cancers, I would never say that there's any cancer that's a small deal. Every cancer is a big deal. But there's some that are relatively easy to treat on a relative scale. And there are others that are very, very difficult, or perhaps even impossible to fully cure. And the conversation is very different depending on the type of cancer. And that's why most of the work that I do is one-on-one, because you really have to know the person who you're dealing with and what they're going through. And it's very hard to give one-size-fits-all approaches in anything in life, all the more so something as complicated and sensitive as this. And so that's certainly one factor. And then secondly, people are so different. There's such a variety within how people are wired. And, I never cease to marvel at how, forgetting about the world of cancer, just in life, there's some people who can go through incredible challenges and adversity, and it doesn't really seem to rattle them very much. And there are other people who may have what others would consider to be relatively minor struggles or challenges that can really throw them off course. And from that observation, all that you can conclude is that as humans, we're different, and we can never judge anybody. Everybody's different, everybody responds differently to things, and all we can really have is compassion and kindness to people, because we never fully know what they're going through or how they're experiencing something. And so I realize that this is a little bit of a tall order to try to give a brief talk about mental health and oncology, but I hope that we can at least touch on a few of the themes that may be relevant for many people, may not be relevant for everybody, and hopefully at least begin a discussion that I think could be very valuable for today, and maybe even beyond in your own lives and in discussing with other people as well. So before I get into kind of the points that I think are just worth thinking about and things that I found in my own experience working with people that seem to help and just be worthy of having in our mind, I just want to give a brief introduction about some of the potential pitfalls of mental health with the journey of cancer. I mean, I'm sure everyone here can very easily understand that cancer and depression, cancer anxiety go very, very closely hand in hand. The data, the numbers are wide ranging. And to be honest, I think it's a very hard thing to actually measure. And that's why we have such a variability. But some numbers estimate up to 25% of people with a cancer diagnosis may experience depression. Again, very hard to know what to make of that. I think it actually may even be more. Depends on the type of cancer, depends on how you define depression, which is obviously somewhat variable, even in the mental health field. But whatever it is, it's clearly an issue that needs attention, of mental health and cancer. And what are the things that can predispose or render someone susceptible to experiencing depression, to experiencing anxiety and cancer? So a number of the things, not an exclusive list, would be obviously fear of mortality, the fear of recurrence if a person is blessed to have achieved remission, or the fear of worsening of illness if a person has more of a chronic condition, side effects of medication, pain of surgery, nausea, weakness, fatigue, insomnia, mood changes, hot flashes, cognitive clouding. All of those things can come from medications, chemotherapy, hormonal treatments. Financial consequences is a big one that I think is not talked about enough. The financial impact that cancer has on people and the resultant effect on mental wellness, on depression and anxiety. Isolation from others is a major one, right? And flip side of that is the fear of being a burden on loved ones, weighs on people and affects their mental health. Fear of body changes, body image, hair loss, surgeries, hormonal treatments can all affect that. Sleep disturbances and deprivation, burnout from just the frequency of medical appointments. I hear that a lot from patients of mine, how they're just tired of having to go to the doctor every week, or to go to the infusion center, or go for the pre-op, or whatever it may be. And then another big thing is sort of loss of identity that I see many people seem to experience, that because cancer is such the elephant in the room in a person's life, that oftentimes it can take over a person's identity, and they kind of forget who they were beforehand. They forget that they still have other roles in life. Even if they're not working, they have other identities. And when we lose those other parts of ourselves, we're certainly at a risk for more depression and for more anxiety. The final point I'll mention on this, of again, the various pitfalls, the predisposing factors that can lead to depression and anxiety and cancer, is a fascinating area that's being explored of biological factors. And there's a lot of research being done now about, do the cancers themselves cause some sort of a tendency towards depression? Perhaps through chronic inflammatory responses, various cytokines or chemicals that are released into the blood by the cancer itself, some have wondered whether or not those may directly cause depression, regardless of whether a person is aware of what's going on or anxious about what's going on and the like. And that's an area in the very nascent phases. I think it needs a lot more research. And at this point, I'm not sure how practical it is. It's not something that I focus on very much because I just haven't seen that much convincing evidence yet for that. I think that things we mentioned before are much more relevant, but it's interesting to be aware of and to consider, and that in the future that may become an increasingly significant factor. In terms of mental illness and cancer, depression, anxiety most specifically, so there are, I think throughout the journey of cancer, throughout the battle, there are difficult moments, but there seem to be a few distinct points in time that are the most difficult for people in my experience. One is obviously the time of diagnosis. Diagnosis is a moment that a person never forgets. They never forget where they were, who said it, how it was said, and people can be filled with shock, denial, anger, paralysis, just being frozen, stuck, not knowing what to do. Oftentimes people will say they remember the doctor spoke to them, they remember kind of how the doctor spoke, but they can't remember anything about what the doctor actually said, that their mind was just somewhere else and in complete shock. And it's very normal at that point to be overwhelmed with anxiety and with depression. Then, of course, people begin treatment. And a lot of the times, once people are underway, treating it, fighting back, if you will, they may find that they're kind of distracted in a healthy way. And they're just focused on what's next, what do I have to do now, what do I do after that? And sometimes, not for everybody, but sometimes it's a little bit of a more gentle period, a little bit more relief there. And then if a person is blessed to have a remission, if they're blessed to be able to cure it in some way, then ironically at that point is when people experience another crash a lot of the time, which people do not expect and is not obvious. Most people would say, once it's treated, isn't that great? Shouldn't I be jumping over the moon? And in reality, a lot of people find the opposite, that they find this to be a very difficult time for them. One is because it's a little bit, I like to compare it to the crash after a marathon. Like if somebody's running a marathon, their adrenaline is pumping, they're fighting, they're pushing. The moment they get to what's perceived as the end, they just collapse, right? Everything shuts down. And there seems to be some phenomenon of that. The reality of kind of their new worldview, which hopefully we'll talk about, of what is the world that I'm in? And like, what can I trust anymore? What's up, what's down? Things that I thought were stable and sources of stability have been pulled right out from under me. And, I just don't know what to do with myself. That certainly is evident in that phase. A feeling of disconnection from others at that point in particular is very prominent. So again, when a person is done with treatment, they're hearing all the time from people, congratulations, you beat it, you're done. And I hear all the time from people, I don't feel like I beat it at all. I don't feel good at all. I feel terrified that maybe something is going to come back and I have to worry about relapse. And they're not filled with any joy. And not only are they not filled with that joy, but a lot of times hearing that from other people makes them feel guilty. They're saying, I should feel grateful. I should be feeling good. Everyone's telling me I should be on top of the world right now, and I just don't feel it. And so that's the second point. First is diagnosis, which I think is obvious. The second point where I see a lot counterintuitively of difficulty with depression and with anxiety is when people have completed treatment and then re-emerging into life. And then the third phase with people who have completed treatment, again, assuming that it's more of a curable cancer in that way, is before the surveillance scans. So that's another big one, right? That people, depending on the cancer, depending on the nature of the illness, every 3 months, every 6 months, every year, they may be called in to do a CT scan or other blood tests. And those can be major trigger points for people. And, already weeks leading up to it, I'll hear from my patients saying, I'm just really, really panicking about doing this. I was able to put it out of my mind for a while, but now it's even worse. And so that's another major hurdle to be aware of. The good news with that one is, in my experience, that does seem to get better for people. That with time, just the more that people get used to going to the scans, as much as that's something you can quote unquote get used to, people do seem to get better with that. It becomes less of a big deal for them, but it still is something that can be very anxiety provoking and for a while. So with that just basic introduction about some of the factors involved and the time period that are most significant, I just wanted to throw out a few points for us to consider of things that I think are important for every patient, regardless of what they're going through in cancer, what type of cancer, to be aware of and perhaps to carry with them if they find it relevant. The first and perhaps most important point that I wanted to share is the importance of hope. Right? Hope is something that is very, very rarely felt in the world of cancer because there's so much fear, and for good reason. But we always have to remember that no doctor has a monopoly on truth. No test has a monopoly on truth. Things sometimes go differently than expected. And I want to be very clear here. It's important to be realistic. I'm not advocating denial. I'm not advocating fantastical thinking. I think it's very important for people to plan ahead and to be aware of what's going on. But at the same time, whatever we do, you always have to keep in the back of your mind that we never know for sure. And that little bit of doubt sometimes can make all the difference in a person's life, right? I've had patients, again, I'm not saying this is the norm, but I was just talking yesterday to a patient of mine who's been stage 4, who's been decades past what doctors told her, she would make. And again, I'm not saying that's the norm, but it's important to remember those sorts of things do happen. I have a friend actually who was very close with his father, and his father was diagnosed with a very serious form of cancer, was told that he had very little time to live. And my friend, who, as I mentioned, was extremely close with his father, couldn't call his father. He couldn't, he said it was too painful. He said he couldn't call without crying, knowing that this might be the last time that they speak. And he said he couldn't visit him. He wanted nothing. He just couldn't see his father because he loved his father too much. And his wife said to him, to my friend, why are you mourning now? Go, you still have your father. Go talk with him. Go visit him. Spend time and cry. Cry when the time to cry comes. And he did. And his father lived for many years, way beyond what they had anticipated. And to this day, he always tells me how grateful he is to his wife for encouraging him to not just throw in the towel and assume that he can't call his father anymore. Because again, things were different than anticipated. So that's one area where hope comes up. By the way, hope, sometimes patients will say, they want to take certain medications that can be addictive and they want to do it in an unhealthy way because they say, well, it doesn't matter if I get addicted because there isn't time. And again, there are patients who have survived and then they're kind of stuck with that addiction. So it's always something you keep in the back of your mind, that we never give up on hope. And hope comes in two forms. One hope, what we've been talking about until now, is prognosis, right? Hope about maybe the doctors are wrong. But there's another type of hope which is equally important, which is hope about how we're going to handle the situation. Forgetting about prognosis. Let's say we don't know. Let's say the doctors are right. Whatever it is, we never know how we're going to feel. And that's an important point to keep in mind also. That a lot of times people assume that things are going to be the absolute worst and that the rest of their life is just going to be agony, anguish, and dark. And I'm not saying that does not happen for people, but sometimes it doesn't. And sometimes even in very, very devastating situations, people find that they're feeling better and that they're living life more than they ever lived before. And they're more conscious of their life and living more mindfully and more in tune with what's going on. And again, that's just something to keep in mind, that nothing do we know for sure. The second point I'd throw out, which may be an obvious one, but I think it still bears repeating, is the importance of connection and support. And that's really what Sharsheret is all about, if you think about it. Cancer can be such an immensely isolating experience. It's a thing that just cuts people off. People are ashamed of it. People feel nobody understands them. People feel they're being a burden. And loneliness is very common in cancer. And interestingly, UCLA, of all places, has done some very interesting work on the medical effects of loneliness and what that can do to us, not just on an emotional level, but on a biological, physical level. Now, loneliness increases the risk of death, for many, many causes, forgetting about cancer. And so that's something we really want to be careful of. I have a friend who likes to say, and it's maybe a little cheesy, but I think it's true, that the human heart doesn't need FDA approval, and that there's no side effects from the human heart. There's no long-term consequences. All it can do is help to have someone who you really feel is supporting you. And here it's important to have the right people, because some people will say, okay, well, I have to have connection, But all of my friends are relationships that I kind of need to put on a show for. Like, I don't really feel like I can fully take my mask off in front of them. And that sometimes ends up being a source of more stress for them, because they feel like they have to have the energy to, be present for their friends. But if you even have one friend or family member who you feel you can confide in and you can share the burden a little bit, I think that that can do a lot. You're a very wealthy person if you even have one friend in this world who you feel you can do that to. Of course, that never takes the place of professional help, because even the most loving of friends or family members may not be able to carry everything. Like we said, it's a lot. It's nothing like what the person, him or herself, is experiencing. But it's hard for people to carry that. And that's why it's important to have other people who you can fully unload on, and who they're there for that. In this vein, if a person doesn't have close family or friends, so like I said, hopefully they have professional help, but groups can also be very helpful for many people. And I have many patients who found their groups to be a major lifeline for them, of being able to connect with other people who really seem to understand what they're going through. And, I encourage people to do that. Groups, like everything, is a double-edged sword. Sometimes people go and they find that the group makes it worse for them, because now they're hearing about things that they didn't want to hear about, or, some people in the group may have had very extreme experiences. But on the whole, people seem to do well with groups. And if you're a group type of person, I would definitely encourage you to do that. If you're the person on the giving end, so let's say you're the loved one or friend of a person with cancer, a lot of times you may feel anxious because you don't know what to say. It's like, what do I say to someone who tells me these things? Like, what's the answer? What's the magic word? As if I have the magic words or the magic lines to say. And what I always tell people is, never underestimate the value of presence. Just being present, even if you don't say anything, even if you're just nodding your head or putting your hand on their shoulder, letting them know that you're there for them. Sometimes it's better not to say anything. Like I said, sometimes, we say things that we mean well, and they end up having the opposite effect. I'm sure, like I said before, in a talk like this, there are probably some things that I say that may be helpful to some and may be hurtful to others. And, sometimes no speech is actually better than a speech, and that's important. For many people, by the way, this is their first time ever reaching out for help in their life. And that's a new issue for them, that they've never had to deal with. And there may be a certain hesitation or resistance to doing that, a vulnerability. But there's a tremendous wisdom in knowing how to get help. And in fact, I always like to tell people we're most human when we're reaching out for help from people, because there's not a single person in this world who doesn't need help with something. And if we're able to connect with someone and to genuinely have that humility to be able to ask for help, to say, right now I'm having a hard time, can you help me with that? That on some level, we're most human at that moment. Those are the moments where we've taken off the mask and we're really being true to what it means. And so that's another very important point number 2, of connection and support, of being able to reach out, going to family members or friends if you have them, getting professional help if you feel that would be helpful, groups if you feel that would be helpful, and just being open to getting that help. A third point that I put out, this is one that is maybe a little bit harder and may be very helpful to some people and may be challenging and even difficult. Some may be resentful at this idea, but I think it's important to think about, is the notion of finding some sort of meaning in our suffering, trying to find some spin, something that takes it beyond the realm of I'm just going through this pain. A teacher of mine once said that pain without a purpose is what we call torture, right? If you're just going through pain and you're not getting anything from it, that's torture. But pain with some sort of purpose is meaning, right? When we have pain and we're doing it, but we're going through the pain for something beyond ourselves, it gives us the power to keep fighting, right? And it's not uncommon for people to want to give up, right? Even at the very beginning, they get a diagnosis, they say, like, how can I go through this? This is just impossible. There's so many appointments, so many side effects, so many this, so many that. When people have something or someone to fight for that can, beyond themselves, that can often allow them to dig deep, to pull from a reservoir that they otherwise wouldn't have if it was just about themselves. This could be doing it for a loved one. This could be doing it for a pet. It could be doing it for a cause that you believe in, that I need to make it through this because I'm involved in this. Finding some reason of why I still need to be here, why this is beyond myself, why there's some purpose in my putting up with this, as opposed to just being tortured by it. And it's a challenge. Like I said, it's not something that everyone finds easily, and it's something that some people may feel is impossible to do, that the suffering is so great. And if that's the case, that's understandable. There's no judgment. But if one is able to find something beyond themselves to be fighting the battle for, that can be very powerful. For people with religious traditions in particular, that can also be a source of strength and of purpose, of why they want to overcome this and to continue. That can be very significant. And then the other side of meaning, again, this is point number 3, of finding some sort of meaning in our suffering and meaning in what we're doing in our efforts, is trying to find something to take from this experience. And again, this is the piece that I mean in particular is not always possible to do, right? Sometimes the experiences are so dark that we just say, I don't see anything to take from this. But sometimes people are able to say that as much as I would never wish this on my worst enemy, that this was such terrible suffering, maybe if I had to go through it, which I would never do voluntarily, at least I better take something from it. Is there something from this that can make me a more patient person, a more compassionate person, kind of seeing what people go through in this world and the level of suffering that they have? Maybe I'll be a little bit more understanding, as a result of this. And again, it's not to say that you went through this so that you could do that, but rather if you had to go through this for whatever reason we don't know, at least I'm going to get something from it. Many people have told me that by confronting the possibility of mortality and the fears of cancer, they find that they end up living much more fully, as we alluded to before, and that they're able to appreciate every minute of life and saying, wow, like what a gift this is, when beforehand they took it for granted. Again, not something everybody's able to do and not something you necessarily should do, but I put that out there for those who it may be relevant for. Another point that I would throw out that I think is very important for all types of cancer, whether we're talking about stage 1 or stage 4 or anything beyond or in between, is the notion of being able to live in the moment. So to be present in what's going on now. So much of the suffering that cancer brings on is not the actual cancer, the actual experience, but it's about being somewhere else in our mind, worrying about what's coming down the road. And of course, that's a very natural human response, and we all do that. But sometimes that can really rob us of the time that we have on this earth, worrying about the future when it serves no constructive purpose, when it's just like spinning our wheels in neutral on a car. We're just going over and over and over in our mind, is this, what's going to happen? What if this is, what if this? And that's something that usually doesn't serve a constructive purpose. Whenever we have a thought, it's helpful to ask, like, is this a helpful thought? Is this something that could help me advance, or is this something that I'm just spinning my wheels? And if it's spinning my wheels, let me try to put my attention elsewhere. Often easier said than done, but with some help, we can often get better at that. Studies show that we make our worst decisions in the middle of the night or as we're falling asleep. That's just not a productive time to be thinking about these sorts of things. And so if it's 2 a.m. and you're up in the middle of the night, everyone else is sleeping and you're ruminating, trying to just recognize the futility of that, and that this is just torturing myself. Let me try to, put it out of my mind, to focus on something that's a little bit more helpful. And again, that's something that takes guidance and practice of how to be able to do that. Another tool that I recommend to people in terms of living in the moment is sort of thinking about how we view our lives and how we can break down time. So, like the Jewish tradition, for example, teaches that on some level, every day of our lives is almost like an entire life. We live many, many lives throughout the years of our lives. Every single day we wake up is like we're born, and when we go to sleep, it's like we've ended the life. And many Jews, in fact, have the practice of washing their hands in the morning when they wake up. And some say that practice is paying homage to this idea, that I'm like a new creation every day, that it's a new existence every single day. This one day is my entire life for today. Every day is a birthday, if you will. And sometimes people find that to be a helpful and a grounding idea, to think about how, like, right now, my entire life is this day, May 5th, 2021. Like, I want to live this day as fully as I can, this particular life. Tomorrow is a new lifetime. Yesterday was another lifetime, but seeing today as a contained individual unit can be very helpful. Saying, the sun is going to set today either way. I might as well be happy, as one of my teachers once said, that either way the day is going to end. I might as well enjoy today. Most people, their life expectancy today is no different than anyone else's life expectancy. Their fears are about the future. Understandable, no doubt, but those have the potential to rob them of such precious time today. Why not have today be a very good day? Okay, if there's side effects, there's fatigue, that can get in the way of today. But if the real issue is just, I'm worrying about what if, why should I take me out of the present right now? Let me try to live as fully as I can. Okay. One other point, again, there are many points you can make. I'll probably just make one or two more because I see that there are a lot of questions. And like I said, I look forward to learning from you. And if I can make things a little more specific, I'd be glad to. Maybe I'll just share one or two more points. One is the importance of a balanced world perspective. So this is particularly relevant when it comes to younger people who are diagnosed with cancers. Cancer makes young people grow up very quickly, right? It really ages people in a very significant way. Before a diagnosis, again, especially with the younger population, but not always, many people have lives that are relatively carefree. Their lives of where are we eating this weekend? Where are we traveling next weekend? Where are we going on vacation? Okay, of course, there's stresses in life. Of course, it's not just a picnic. But life is very much about what are we doing, never thinking about broader, more existential issues. The thought of illness, getting a diagnosis, the concepts of disability, of confronting the possibility of mortality for the first time is not on their mind. And when they do experience it, it can just be devastating to the point that the pendulum can swing to the complete opposite side, where now it's like life becomes short, pointless, morbid. What's the point of enjoying anything in life? When I've seen this darkness of what life brings. And so one of the things we work on, and this is true for any type of cancer, is trying to find some middle ground between those two extremes. That just because after the diagnosis, life is no longer that carefree party, if you will, that it may have been for some people, it doesn't mean that the opposite extreme is true either, and that there's nothing to be enjoyed, and that there's no purpose, and there's no meaning, and there's no moments where we can celebrate and be happy with what we're seeing in the moment, whether it's a family event or some good news that we hear about people or another person's success. So trying to find that middle ground is very, very important. And keeping that balanced worldview and checking yourself, saying, hey, have I slipped too far into that just morbid, cynical, negative view, which is totally understandable, but is there a way that I could balance that out a little bit, just to have a little bit more of a balanced perspective, middle of the road, that ultimately helps us to feel better and to achieve more within our lives. Okay, maybe the last quick point I would make is just the importance of being able to deal with uncertainty and unpredictability. That's a major, major factor in depression and in anxiety. Relates to a lot of what we've discussed already, but so much of the pain that people experience is with the uncertainty, waiting for lab results, waiting for the date of the scan, waiting to find out what's going to happen. And this is another area that challenges a lot of people, and that there are techniques that can be helpful. Practicing acceptance is very important here. Being able to accept what's going on, to accept that I feel this way. Acceptance not in a sense of agreeing with it, but accept that this is what I feel. There's nothing that I can do about it at this moment. I might as well try to do something else, as hard as it is. I might as well try to stay busy, to focus on something else, to pick up a hobby, to go out with some friends, as much as I don't want to do this, because staying home, ruminating in my mind is just not going to get me anywhere. And trying to accept that discomfort, knowing that it's normal, that everyone goes through this pain of wanting to know and not knowing. That's something that's very important to attend to, of how am I doing, and how can I improve that? The title would be, somebody asked, dealing with uncertainty and unpredictability. it's usually not a helpful thing to be ruminating. Like I said, spinning our wheels in neutral. Okay, I think there's more to say, and I had hoped to talk a little bit about some concrete coping strategies that sometimes can be helpful, but I think I'd rather leave it at that and open it up for maybe a few questions that people may be wondering or have been grappling with. Just to review what we talked about this afternoon, we looked at mental health challenges with cancer, some of the prominent things that can predispose a person to depression and anxiety, some of the periods in treatment that are most vulnerable to depression and anxiety, and then just a number of points that I thought are helpful at whatever stage of the journey, whatever stage of the fight a person is in traversing this road. And those are the notions of always maintaining some sense of hope, obviously balanced with realistic thinking, the importance of connection and support in our lives, genuine connection and support in our lives, the importance of finding some type of meaning within our struggles, within our suffering, the value of living in the moment rather than being held hostage to some point in the future that may or may not come, the importance of a balanced world perspective, so trying not to become completely giving up on life and on the joys that can also exist in life together with the darkness. And then dealing with uncertainty and recognizing, how am I dealing with the uncertainty? How do I cope with that? And do I need to get a little bit more help with that? Why don't we leave it at that? And we can now open, I think Jenna, you may have a list of questions or other comments.
Rabbi Wiener, that was just incredible. Thank you so much. And I can see all the comments in the chat and the support there as well, which I really appreciate for everyone who's commenting. I know you said that you did have a list of coping strategies. We actually received so many questions about specific coping strategies. I'm wondering if I can turn it back to you for a few minutes, if you can give us some of those highlights. I see nodding, so if you don't mind doing that.
Yeah. So what are some of the things that we can do to try to help achieve some of those goals we were mentioning? So on the most broad level, therapy, I wouldn't call it a coping strategy, but it's a source of coping strategies, right? Is very, very helpful for a lot of people, and particularly seeing a therapist who is oncologically trained, who is familiar with some of these issues. Medications can sometimes be helpful as well. I wouldn't call it a coping strategy, but it's a coping tool. Medications are helpful both for the depression and the anxiety in the right context for the right patient, but they can also help other side effects that people may be experiencing from treatment. So things like appetite or sleep, fatigue. Sometimes they can help hot flashes that people may experience from some of the hormonal treatments. So that's another helpful tool. Self-care is very, very important. Very important. It's so easy to forget about ourselves when we're just being bounced around, it feels like, from one doctor to another, making sure we're trying to get enough sleep. I always tell people, you can't set a goal of getting 8 hours a night, because goals should be things that you can attain if you work to them. Sleeping is not really in our control. They're just like, I can't set a goal if I want to jump up and touch the ceiling if I can't reach the ceiling. But you can set a goal if I want to rest for 8 hours a night. I want to rest for 8.5 hours a night and say, I'm going to try to just tune out the world, put the world on mute, if you will, for 8.5 hours and get as much sleep as I can. That's very important. Other things are meditation, of course. There's been a lot of data. I know people have commented on that for many people, they find that to be a grounding experience. Spirituality, religion can be a very powerful coping tool for people, a very powerful one if that's something that they're familiar with. Another thing that I've sometimes recommended, and I think does help people, is sometimes, like, if you're really anxious, say you're in the doctor's office, you're waiting, some of my patients have found it very helpful to focus on what's supporting you right now. And you can even do this at this moment, like feeling the support of the chair on your body, or feeling the support of the floor on your legs. Sometimes that's just a very easy reminder that we're never completely on our own. We're always being supported by different things. And that can be a grounding experience in the heat of panic or of anxiety. Similarly, one patient of mine told me she likes to focus when she's in the doctor's office. She'll find like a pretty picture on the wall or a pretty plant or just a nice carpet, to focus on some detail that says, hey, like that's actually very nice, and getting pulled in, if you will, on that pleasing image, even if it's something you normally would never even notice or never stop to think on. That can be a helpful coping strategy. Sometimes I encourage people to think of comforting people in their lives. So that this is particularly good for those 2 in the morning moments where you're up, you're in a panic, your mind is racing, you can't think about anything. Sometimes it can be helpful to like imagine a comforting person just sitting there, by the door. So they're not even saying anything, but someone who you see in your life as comforting. And if you don't have anyone like that, you can think of who would be comforting for you. Who in history have you studied about who you think would be a comforting presence, and just trying to feel that. If they do, for many people, they speak with God, and they see that as the ultimate comforting presence, which can be very grounding for those moments. Deep breathing, I know it's a little bit of a cliche perhaps by now, but it really does help a lot of people. There's increasing evidence that when we breathe slowly, and I would put less of an emphasis on the specific number of seconds per breath, as much as for you, what's comfortable, to slowly breathe in, hold it for a couple seconds, and when comfortable, let it out very slowly. What that does is it flips on like a master switch in our brains called the parasympathetic nervous system, which is sort of a master switch that just relaxes the body. So breathing slowly can slow down the heart. It gets more oxygen to the brain, opens up the lungs, helps with digestion. And again, it's not an instant effect, but if you keep doing it, you don't give up. After a couple minutes, you should begin to notice a sense of calm coming over you. Sometimes people, if they're in the throes of like a panic attack, are just really overwhelmed, sticking their hands in ice water, sticking their head in ice water. Again, just talk to your doctor beforehand, but just something that just pulls you out of it, like a jarring, almost like a shock like that, can be helpful. Something like flicking a rubber band, people find can help distract them. They put a rubber band on their wrist. And again, there are many, many more. I'm just giving you a sampling of some of the things that I think could be helpful, both on the more formal level, like medication and therapy, and on the more day-to-day, in-the-moment level of kind of the deep breathing, the rubber band, the ice water, the imagining, etc.
That's great. Thank you so much, Rabbi Wiener. And you touched on a lot of different coping strategies that we also had different webinars for over the past year. So I thought maybe we could just share that in the chat, which I'm going to do right now for anyone who wants some specifics about all of these issues. And I'm going to ask my colleagues if there's any more that you think I'm missing to please share that as well. We did get a lot of questions specifically around use of medication as well as cannabis. I did put in the chat the link to our webinar on cannabis use. But Dr. Wiener, if you don't mind maybe expanding a little bit on when someone should be considering, or when they should have the conversation with their healthcare provider about using medication to help manage anxiety and depression.
Yeah. So, there are some people who believe, and I don't think it's a ridiculous suggestion at all, that every patient who gets diagnosed with cancer should get an automatic referral option. They don't have to take it, but a referral option to a psychiatrist for a medication evaluation of whether it would be a good thing. Very, very hard to give a blanket rule on kind of who would be a good medication candidate, who would not. Some of the rules of thumb that I think of are, one, history. So if someone has struggled with depression and anxiety in the past, they're at a higher risk during the cancer treatment to have a relapse or recurrence of that. That might be a reason to be a little bit more proactive in taking something if they've taken it before and it's helped. I tend to be more of a minimalist in general. So I think, before going to medication, not that there's anything wrong with it, but I usually recommend people to try a little bit of therapy, try some of the coping skills, see if any of the non-pharmacological interventions could help. And if they're finding that that's not working, then certainly to get a referral for psychiatry. Again, it's a very hard call. You really want to look at a person's support structure, their history, how intense their symptoms are, where in the course of treatment they are. But I think it's always better to err on the side of caution. And so if you think that, hey, like I'm struggling and I'd like something to help me a little bit more, definitely meet with a psychiatrist. Set up an appointment. A lot of people forget that meeting with a psychiatrist doesn't mean you're going to take medication. It just means you're going to get evaluated for it, and they're going to give you an honest recommendation if they think it could help or not. So, those are some general rules of thumb. Things like panic attacks, like if you're really panicking, meaning that your heart is racing, you can't breathe, it becomes totally overwhelming. That's usually a sign that medication could be helpful. Severe depressions where you're kind of not getting out of bed, not functioning, not eating, that would be another sign to be going a little more quickly the medication route. But ultimately, it's a very personal decision. And like I said, I would probably start with a therapist in most cases and have them either suggest or you on your own then up it to considering medication.
Thank you. And a topic we could do a whole other webinar on as well. So I know there's a lot there. So we received a lot of questions about, and you touched on the importance of using your social network, family and friends through this journey. Can you provide us with some language for how to maybe ask for help from friends or family, or to be able to communicate that you're experiencing anxiety and depression? A lot of questions around stigma and really trying to have open conversations with family and friends.
Yeah. So again, it's going to depend very much on your prior relationship with the family or the friends. Have you ever reached out to them before? How close do you feel to them? But there's nothing wrong with saying to anybody, I'm having a hard time. I'm having a hard time. Could we talk? Or, could you come over? And sometimes it takes a lot of courage to ask a question like that, especially if you've never done it before. And it's a question that you'll rarely regret doing. You may be disappointed. In all fairness, not all friends are the type of friends we want. And sometimes, unfortunately, we learn that during difficult times. But it's certainly worth doing. And just saying, I need help. Can we talk? And even better than saying, can we talk, you say, could you listen? Could I just vent to you? Could I speak to you what's on my mind? And sometimes that also can allay the anxiety of the listener, because like I said before, some listeners are afraid. They feel like I'm supposed to have something to say. I'm supposed to be able to help. And I have no clue how to help. And the honest answer is you're not supposed to know how to help. All you need to do is to be present, to listen, to acknowledge what they're saying, and to try, if you can offer things like bringing over meals or coming with them to an appointment. I think that's a wonderful thing to do. But the most important is just the presence, letting them know that you're there.
Great. And I know that we're getting so many questions and we're not going to get to everything. I'm trying to combine a lot of the questions that came in so we can get through them. One thing, Dr. Wiener, that a lot of people asked was, can you provide an explanation for the impact of treatment on brain functioning? There were a lot of questions specifically around tamoxifen, but also endocrine therapies. How does treatment itself impact functioning? Again, could be a whole topic, but if you can address that.
Yeah. So for each of these, I'm trying to give just like a sound bite. There's probably a lot more to talk about, but at least starting off point. So brain function, when I hear brain function, I'm thinking more like cognitive function, memory, attention. There, we often see from the chemotherapies, people will often complain that they're just not remembering things as well, not as clear. The colloquial term that my patients like to use is chemo brain. I'm sure any of you have heard of that, where they're finding that cognitively they're just not as clear. And I think you said you had a webinar on that at one point, so I won't get into that. But just very briefly on chemo brain specifically, sometimes people find medications can be helpful for that. Certain stimulant medications that can help with attention and with focus are worth asking your doctor about. We will prescribe those and see benefit from them. In terms of other like mental health issues, from say something like tamoxifen. So tamoxifen is a very interesting medication where there's a lot of data that seems to show that on the whole, tamoxifen doesn't cause mental health symptoms, depression, anxiety, mood swings. But I can sure tell you from speaking with people who take it and then who come off of it, many people do seem to experience some sort of effect, whether depression or anxiety, mood swings, mental clouding. And the current thinking seems to be that there's probably a subpopulation that maybe in the broader data gets washed out, but that for reasons we don't fully understand is more susceptible to the effects of tamoxifen on these functionings. It's a little bit like, I always like to joke about, the proverbial statistician who drowns in a river whose average depth is 1 foot. So we say, you hear, oh, the average depth is 1 foot. It's a shallow river. No, it could have 100 feet depth at one point, but the average washes out to one foot. And it's the same thing with a lot of these studies. And that's why a lot of the mental health and medical data is flawed, is because we're looking at large populations that kind of average things out and will be true for many people, but not necessarily for everyone. And so with tamoxifen, I always tell my patients, I say, first of all, go in with an open mind. Because if you go in expecting it to be bad with all the things that you've read on the chat groups online, it's going to be bad, right? That's what we call the nocebo effect. It's the opposite of placebo. If you expect something to be bad, it very likely is going to be bad. So you have to realize many people take tamoxifen and do just fine. They feel perfectly fine. They don't have issues. And it's important to go in hoping and anticipating that you'll likely be one of those. That being said, many people do seem to struggle with it. And in that case, medication can be very beneficial. I sometimes say half jokingly that I think that, some pharmaceutical companies should make a combo pill of tamoxifen and Effexor in one pill, because so many people seem to benefit from them. Effexor is an antidepressant medication that goes particularly well with tamoxifen, and it can help with some of the mood swings, the depression that people seem to feel. It may also help with hot flashes, which sometimes people experience on tamoxifen. And so I very commonly prescribe those too. When people come to me saying that the tamoxifen is just very hard to handle.
We are unfortunately out of time, Dr. Wiener. Very quickly, can you just provide, and maybe you don't know the answer, but is there a central place where people can go to vet a potential psychiatrist or oncological psychiatrist? I know that at the end of this call, we're all eager to learn more and potentially talk to someone.
Yeah. So there are some, like I said, at UCLA, for patients who are being treated at UCLA, we have the Sims Van Center, which offers both therapy with therapists as well as medication management. I know St. John's was talking about doing something like that. I don't know if they ended up doing it, but I think they're in the works of doing something like that. Otherwise, I don't know specific references. I know there are a lot of, cancer support resources out there. I'm sure Sharsheret probably has quite a number that can give referrals, but they're not that common. But to be honest, if you can't get in with a specific, psycho-oncologist, as they call it, just see a regular psychiatrist. Most of them should be able to deal with it and, to have some basic information. And if you're finding that after seeing them, it's not working, then I would work harder to try to find the specialists who may have some other ideas. But like I said, it may just be harder to find the specialist off the bat, and I wouldn't let that hold up your treatment if you're struggling.
Thank you so much. And yes, Sharsheret's social workers are available as well to help navigate resources in your area. I know we have people from all over the country on this conversation. So thank you, Dr. Wiener, so much. Everyone, please, if you can, fill out our brief evaluation survey. The link is going to go in the chat box right now. And again, we are here for you. Please don't hesitate to contact us by phone or email, as well as to speak with one of our genetic counselors. Save the date, and you can sign up right now for one of our upcoming webinars, Shalom Shabbat, our Shavuot Bake Fest, and our Zentangle Therapeutic Doodling. From all of us at Sharsheret, thank you so much for joining us today. Thank you again, Dr. Zev Wiener, for your incredible talk, and we look forward to seeing everybody again soon.
Wishing everyone all the best. Should hear good things.
Thank you.